Did you know that 1 in 300 youth has an undetected heart condition that puts them at risk for sudden cardiac arrest? As primary care practitioners, you are on the front lines when it comes to protecting young hearts from sudden death. And yet, studies show that cardiac consideration is an often overlooked area of assessment, with practitioners and parents largely unfamiliar with warning signs and risk factors that require follow-up. In fact, the standard approach to well-child checkups and PPEs can miss up to 90% of heart abnormalities. Consider the evidence. Up to 72% of sudden cardiac arrest is preceded by symptoms, which often go unrecognized. And in cases when an SCA victim had reported symptoms, up to 60% of practitioners did not consider a cardiac diagnosis. What's more, up to 49% of victims had a significant family history that should have triggered diagnostic testing. But as few as 15% of practices annually update their patient's history, which means changes in a family's heart health could be missed. Nationally reported data shows sudden cardiac arrest is a leading cause of death among youth, and arguably, it is the only one that can be prevented with tools we have available today. So why aren't we? Symptoms go unreported because youth aren't asked if they're experiencing them. Parents just check the box instead of thoughtfully completing health forms with their youth. A more comprehensive cardiac risk assessment at home and in the doctor's office could prevent the loss of thousands of youth each year. Don't take a chance with a child's heart. As new guidelines recommend that youth who've had COVID-19 exposure, symptoms, or a diagnosis get a comprehensive cardiac evaluation, now more than ever, practiced cardiac risk assessment is a critical initiative for this next generation of young hearts. Incorporate the latest American Academy of Pediatrics Bright Futures recommendations into your practice. All children should be screened for the risk of cardiac arrest and death, regardless of their athletic status. A critical step in our vision to eliminate preventable deaths and disabilities from sudden cardiac arrest in youth by 2030. Connect with ParentHeartWatch.org to learn more.